I have been sitting here listening to this very carefully. People mentioned that there were less suicides in 2020. My cousin committed suicide in 2020. She had and my family, her family has been very public about this. When she died, they were very public because they want the silence and the stigma to end. This should be something that we talk about. Mental health needs the parity with medical health, with physical health, and we need to pay attention to this. She was a very vibrant person. She was a teacher. She was married. She loved her family, but she constantly struggled with depression. And so we do need these beds. She had insurance, and she couldn't get a bed. And I'm very torn with this because, again, we need beds. She had insurance. She was a teacher. She had good insurance. She was actually hospitalized, and within 48 hours of leaving the hospital, because she couldn't get into a longer-term treatment, and they said, well, they basically kicked her out of the hospital, that we can't find a place for you to go, so we're sending you home. We think you're okay. Well, she wasn't. 48 hours later, her husband found her. So one of the concerns I have with this, and I don't know how I'm going to vote because we need more beds, but her health insurance company also said, well, you just have a mental health issue, you don't have a dual diagnosis. So they found a bed for her, but because she didn't have a dual diagnosis, they wouldn't allow her to go to that place. So one of the questions I have here that I encourage this body to continue looking at is to force those health insurance companies to cover it. Again, it's about parity. And in here it says that the system to provide primarily mental health services or substance abuse disorder services, well, she knew she had depression and she knew she was struggling with mental health, so she did not drink, she did not take drugs because she was on medication, and so that actually in the end was the problem, because they said, well, you don't have a dual diagnosis, so we can't put you in this bed. So that is one of the concerns I have with this language. Because what does primarily mental health services or substance abuse disorders do you mean? What does that mean? Because can they say, well, again, we're not going to take you? So I don't have an answer. But I urge all of us that we need to continue working on this. The senator from Anoka said that we need to end those barriers to access, and that is true. But it's not just the beds. We need more beds, but we need the health insurance companies to stand up and start covering it. And we need people to start paying attention and get that parity. I vaguely remember, and I'm pretty sure, that former Congressman Ramstad passed the Paul Wellstone parity, mental health parity bill. And we still don't have parity. We need to get parity. Mental health needs to be taken seriously, and we need to do something about it. Thank you.